Just
Good morning, everybody. We're going to give a few minutes to let everybody get into the room and get started. Thank you for your patience. Give it one more minute and then we'll get started. Okay, I think we're going to get started now. Welcome, friends, to our final webinar in the Improving Data Use in Immunization Supply Chain Management webinar series. Today's webinar will cover data use in coordinated supply planning at country level. And just to remind you, today's webinar is being recorded, and we will share it with you in the follow-up email along with the presentation slides and some other resources. So we will be sharing everything with you, no problem there. As most of you know, my name is Barbara Lamphere. I'm a senior technical advisor with JSI, working in supply chain and capacity development and organizational strengthening for many years across programs and across many different countries. I'm pleased to be joined today by two colleagues, Leila Akhlagi and Janet McKenna, who will share with us the work they are doing to assist countries to do collaborative supply planning for COVID-19 vaccines and related supplies. Leila, please go ahead and tell us a little bit about your background and the work you do at JSI.
Sure. Thanks, Barbara. Good afternoon, evening, morning, everyone. My name is Leila. I'm a senior technical advisor at JSI. I've been here for about 12 years. Had over 20 years of experience, mostly working in supply chain management and focusing in the areas of forecasting and supply planning. I'm a pharmacist by background. And prior to starting the collaborative supply planning work for vaccines, was a founding member of the family planning CSP work that has now become eventually the Global Family Planning Visibility and Analytics Network.
Thank you, Leila. Janet, we'd love to hear from you and a bit about your background and what the work you're doing at InSupply.
Thank you so much, Barbara. Hello, everyone. My name is Janet McKenna. I am an MLE advisor at InSupply Health, and InSupply Health is an affiliate of JSI that's located in Kenya. And I have close to 10 years of experience in monitoring, learning and evaluations and health system strengthening. Specifically as part of the work that I do at InSupply, this includes utilizing some participatory MLE approaches to strengthen the health programs that we are implementing. Thank you.
Thank you. Welcome, Janet. All right. While this is the last webinar in our current series, I want to remind you that all the recordings of all the webinars are available to you, and that anyone who has attended 5 or all of the webinars in this series, either live or on demand, will be awarded a certificate of participation. You must view any missed recorded webinars by July 1st this year to receive a certificate. So I will share the links for all the recordings in my follow-up emails. So we hope that if you've missed any of the previous webinars, you'll take the opportunity to view those webinars again to help enhance your learning. And as always, I see people are already doing this, but please introduce yourself to each other and to us using the chat functions. Tell us your name and where you work. And then at the end of the webinar, we will have, at the end of the presentation part, we will have time for questions and answers. So please use the Q&A button on the bottom of your screen to ask your questions, and we'll do our best to answer them during the webinar and definitely at the end. And if there's any remaining questions at the end of the webinar, we will do those offline and share those with you when we do our follow-up email. So now on to today's webinar. So I want to quickly review the objectives. Remember, this webinar is on coordinated supply planning. So we're going to discuss the importance of sharing data and coordinating supply inputs to ensure continuous availability of vaccines and immunization supplies. So that's one part of the purpose of supply planning, is to make sure we have that continuous availability of supplies. We're going to describe the purpose, principles, and benefits of coordinated supply planning. And we're going to identify the data needed to implement coordinated supply planning, mechanisms for securing data, processes for triangulating the data, and mechanisms for managing and sharing data. So as we begin our discussion of coordinated supply planning, I thought it would be important to provide a brief refresher on health commodity quantification so that we are all using the same language and have the framework for where supply planning fits in the quantification process. So on this slide, you will see this definition of quantification. Quantification is the process of estimating the quantities and costs of the products required for a specific health program or service, and determining when the products should be delivered to ensure uninterrupted supply for the program. This definition applies no matter the health program and applies to quantification of vaccines and related health immunization supplies. So as we can see here on the diagram of the logistics cycle, the results of the quantification are used to inform our procurement actions. And that's where its place is in the logistics cycle before procurement. And as I'm sure you're all aware, quantification involves these 3 steps. Preparation, which includes the quantities, the data that we need to estimate. The next step, the forecast, the quantities required of products needed to meet demand in the future. And that information about forecasting and other information that we capture on pipeline requirements and stock on hand all feed into the supply planning, the activity that uses the forecast along with that data to determine the procurement quantities. So this is where we're starting off today, is with that supply planning step in the quantification process. The final output of a quantification is the supply plan. And the supply plan is for procurement and the delivery of commodities. And it includes the total commodity requirements, that is the quantities of each product to be procured, each vaccine, each syringe, and so forth that we need to procure. It also includes the commodity costs, and the costs beyond just the product. Those shipping and handling costs are also part of that supply plan. The funding sources and funding commitments for each product, and a planned delivery schedule to ensure that continuous supply. And if you use a max-min system, in order to maintain those max-min levels as appropriate in your pipeline. In summary, when developing a supply plan, we are applying the forecasted requirements to the current supply pipeline, the system pipeline. Some of those pipeline elements include the stock on hand and the amount on order and supplier lead times. And the reason that we are applying these forecasts and using these pipeline parameters and different pipeline elements is to help us determine when best the products that we're procuring should be received, and what shipments and orders, when we want those to be received, to ensure there's always an adequate stock level in the program, and to prevent overstocking or stockouts. So let's take a few minutes to think about the data we might need to do a supply plan for a vaccine. And I'm going to ask you to think about this. I'm going to launch a poll, and I would like you to select, when I launch the poll, the data items that you use when developing your supply plans for vaccines. So I'm going to launch this poll, and I'd like you to check those items that are the ones that you use when you do your supply planning activities. So please go ahead and select the polls. Okay. Think about all the different data that you use when you're doing your procurement plan, supply plan. Sometimes it goes by different names. I'm going to give you just about 10 more seconds. Okay, let's see what, I'm going to end the poll, and I'm going to share the results with everybody. And let's see. Well, great. Everybody is, most everybody that has responded is using forecasted demand for the vaccine. And of course, those pipeline elements of stock on hand, shipments, buffer stock, or inventory management system, that if you're using a MaxMin system. Great. Wastage rates, and wastage rates, as we know, are very important when you're doing vaccine supply planning. So we're gonna talk a little bit about that a little bit later. And funding important. Those are all the important elements. So let's look at some of these elements in my list that I'm going to share here. Okay, so data for supply planning. These are the important things that we think that are important to think about and to use when you're doing your supply plan. And we're going to learn more about this as we learn about the COVID-19 vaccine collaborative supply planning initiative. I would like to now turn the webinar over to Layla, who will introduce us to this project and the activities that they're doing in supply planning at the country level for COVID-19 vaccines as an example of how to do collaborative supply planning. So over to you, Layla.
Thanks so much, Barbara. We can go to the next slide. Thank you for that overview. I think it's always important to start with the right definition so everybody is on the same page. And I want to tell you a little bit about our collaborative vaccine supply planning initiative. We started out last summer and end of August or so in 2021. It's 2022 now, yes. And are working with a number of different organizations and partners in about 16 countries now, and have leads in a few others. So as you're listening to this, I know I see some familiar names. You're part of it as from your organization, but if you're interested, there'll be a contact email at the end of the session that you can contact us and to learn more. We work with our partner organizations who are helping ministries of health, and a number of our countries, we actually work directly with the ministries of health themselves. So our mission is to work with those governments and their partners to strengthen their capacity to do collaborative supply planning. And that means to collect, aggregate, and triangulate various different data sets. As you saw in that last slide that Barbara showed, there's a lot of different data that's required for proper supply planning work. And we pull that all together and translate that into something that it allows the government to be a little bit more agile and responsive when trying to manage their supplies for vaccines, especially those for COVID-19. Our goals are to enhance operational decision-making by those programs and supply chain managers and those implementers so that there is adequate immunization supply to meet the population's needs, to strengthen our capacity for providing supply planning and improve data visibility as we're doing this, and the processes for supply planning, not only at the country level, but we do think that when you strengthen country forecasting and supply planning, you're making better effective forecasts to be used for regional and global suppliers as well. And supporting government's leadership in advancing proactive and collaborative supply planning. Our hope is, and we're slowly getting there, is not just to do this for COVID-19 vaccine, but to move forward with other vaccines because we're getting the interest and the request to do that for routine immunization as well. So what we're learning from this process will be transferred over to routine immunization, and all the countries sharing what they're learning amongst each other. We can go to the next slide. And how are we doing this? So what makes us separate? What is it when we say, collaborative approach? And Janet will go a little bit more in depth into that process, but in order to, help to make operational decisions for supply chain managers, we have identified a few things that set us kind of this approach apart, which is using periodic consumption data versus coverage or aggregate consumption. And so not looking at your historic, where you are from the beginning of the year to now in terms of a percentage of the coverage, but how much did we do in January? How much did we do in February? And what was the cause to result in that level of consumption? Was there a campaign, or was there a number of access points that were reached that allows for that kind of coverage? And what do we predict that to be in the future so that we can use the consumption numbers for forecasting better? And being able to look at those trends and patterns in a disaggregated format rather than a campaign total or a coverage total. We're consolidating various different data sets together in one place. We're not replacing or duplicating anything that currently exists. So if there's an HMIS system that's in place, we take the data from it and we want to strengthen what's already there. If there's an ELMIS system, we help to strengthen that and take the information from it to be actively used and put it in one place so that when you're doing supply planning exercises, there is no need to have 5 different spreadsheets open or have 5 different platforms open to gather the data. The data is already there in one place, and it visualizes the information that you need to make those decisions. We're working to strengthen the national logistics working groups to allow for them to proactively and routinely monitor stock management risks. And we're standardizing this process across all of those countries and partners that you saw in the earlier slide, which not only allows those countries to share amongst each other what they've learned and how they've improved things and the challenges they're having, and to learn from others what they can do to address those challenges, but having a standardized process then allows for a cross-country view of what's happening and a way to analyze data to learn across countries what's happening. And we also have the unique opportunity of this adaptive learning process, which is a strong point in our project, is to take those learnings from the country activities and understand what our challenges and weaknesses are, and then to reapply perhaps a different process or a different approach to address those weaknesses so that we can learn from it and continue further improvement, which Janet will delve into a little bit as well. Next slide. And so the kind of data that we're looking at, and some of this came across in Barbara's slide, was, taking the information from the consumption or daily call-ins or DHIS2, disaggregating it if it's not already there to look at doses administered per month and their open vial wastages so that we can address any wastages as part of the consumption, because that will continue to happen in a future forecast. We're looking at all shipment information, not just COVAX, but anything that is coming through donations or bilaterals or AVAT, and making sure that all of the shipments and all the supplies entering the system are located in one place. We're looking at any other adjustments that are happening, any transfers in and out, any losses due to expirations, anything that can't be usable due to some other reasons, such as, loss in transfers or a cold chain breach, for example, and then pulling in the population data to look at coverage rates, both in terms of past consumption, but also future looking scenario modeling, what that will mean in terms of coverage. So some initial outputs that you should be familiar with, and with all of this information, we then have beginning and ending balance. So instead of an input of the inventory, we are taking the input of inventory from what's calculated in terms of shipments coming in and out and consumption leaving the system plus the adjustment. So the balance can only be adjusted if it's used or it's coming in. We project what the inventory has and when that inventory will expire, so it can allow the users to adjust for any risks for expiry, and then translating that information into months of stock. So how long does our current inventory reflect in terms of, if current consumption patterns continue, this is how many months of stocks we have. And if you change that forecasting model to something else, then your months of stock will remain this amount. And so knowing how long your stock lasts based on different scenarios allows those decision makers to make the appropriate decisions for how much they will need moving forward. I think for this slide, that's about it. And I just wanted to give you a glimpse as to what the tool itself looks like. It is, again, to reiterate, it doesn't replace any other routine data collection system. It's meant to triangulate that information for the purpose of supply planning only. It's a Excel 365 tool currently, which allows users to use that online or offline. And it gives us the ability to provide permission-based access. So it's not open to anyone to have access to that data. The country decides on their own who has access to view and who has access to edit that information. We're working on a data use policy and agreement that our members have commented on and that we're reviewing to send out a revised draft, so that we do acknowledge and work with the country partners and the governments to ensure that their data is only being shared with those who they want to. And so the first view that we'll share is where information comes in for supply planning. We have the light gray cells are calculated fields, and it might be hard to see on your screen, but with the recording, or if you have interest, we can share with you a bogus or an any land tool so you can play around with. The beginning balance is calculated from incoming shipments, and the user has the ability to filter for the products and the dates, to enter in doses administered, either first, second, or booster. Add in any open vial wastages, and then any adjustments to that stock with the various reasons. Shipments coming in, whether they have been received or ordered, and then anything that's a potential expiry will calculate based on the first expiry, first out rule. And then you have the ending balance with the months of stock on the side. Now, if you're doing supply planning, you do want to look at this in an aggregate. And so the next screenshot shows us the tab that has the aggregate view, which at the very top of the screen will tell you what the averages have been for consumption as a total for the last 3 months and what the maximum for the system has been, which helps the user decide what they may want for a forecast, plus various other reasons that they might have, such as policy changes and campaign plans and funding resources. And forecasted doses can be entered into the first dark gray column with any additional wastages, where if the user has been entering wastages, there's a default that will pop up into the blue cell at the top. The user can then see if what the ending balance is and what that represents in the months of stock. You see some that are green and orange. That's a conditional format. If you enter a min and max, the supply plan will tell you whether or not, based on this forecast, you have enough months of stock on hand and what the quantity may be to reach the maximum that you have entered. And so this is just two views of the 5 or so different tabs that we have in the system that maybe help you understand a little bit about the technical aspect of doing this work a little bit better. And I'm gonna next hand over to Janet, because although we're talking about the technical approaches and the data that you need to make this work, there's a whole lot that goes on in terms of the process that's probably even more important, and Janet will talk about that.
Thank you so much, Leila. If you can go to the next slide. I'll now take you through the maturity framework that we developed for the Vaccines Collaborative Supply Planning Initiative. And as was earlier mentioned by Leila, we utilize adaptive learning, which is an MLE approach that uses implementation experiences to inform the decisions, and it involves deliberately taking action in order to learn and adapt as needed under conditions of ongoing uncertainty. And what we do, we routinely collect insights across the country programs, including the challenges, to inform how we want to shape and adapt the approach and what we are doing. And this entails having monthly deep dive sessions just to review the data with the initiative staff and other stakeholders. And the aim for doing this is to be able to discuss and come up with some solutions and potential approaches to some of the common challenges that we're identifying across the different countries. And a few months into our work, we acknowledged that it was important for us to assess the countries, even as we continue to strengthen their capacity for supply planning and improve the data visibility and use, alongside the strengthening other supply planning processes at the different levels within the countries. And so what we did, we started off with a simple 2x2 heat map matrix, which we used to plot where the different countries were in terms of supply planning maturities. And this focused on two key things. So the first thing was the routine monitoring of the COVID-19 supply plans, which is what we see plotted on the x-axis. And we established whether this was currently happening in the countries, or if the countries were at the stage of setting up structures for routine monitoring, or if they were at an earlier phase of maturity, where they only had awareness about the key supply planning elements. And then the second thing that we looked at, which is what we see plotted on the y-axis, is the availability and use of a comprehensive tool for the analysis that can be used to inform the supply planning initiatives. And while this, we can go to the next slide. So while this matrix was good at giving us a glimpse into the status of the different countries, it had some limitations that we needed to address. First, it was prone to subjectivity, such that two different people would easily plot the same country at different levels based on their interpretation of the country's context and situation. And then secondly, it was not easy to translate it into actions in terms of what are some of the practical things that could be done by the countries to move to the desired quadrant of proactive monitoring of their supply plans. And we were also working on developing and defining the characteristics of proactive supply planning, still through our adaptive learning work. And moving on to the next slide. And this supply planning, the proactive supply planning characteristics, they holistically contribute to strengthening the supply planning practices through the collaborative efforts of all the relevant stakeholders that are working in country to be able to achieve the desired state of proactive supply planning by the countries. And we categorize these characteristics under 5 broad areas. The first one being commitment and political will. And here we're interested in knowing whether the foundational structures for vaccine supply planning initiatives in the countries are in place. So does the country have terms of reference or work plan or an MOU, for example, or is there inclusion of all stakeholders in the supply planning efforts? And if adequate resources are allocated to the process, just as some of the examples. Then the other category is data, and we've heard from Leila and Barbara on the inputs and also the initial outputs that are key for supply planning. And so here we focus on the presence of our system to collect the disaggregated data, access to the data in a timely manner, which is important, and whether the data, such as stock balances, are accurately and routinely updated. And then it's not enough to just collect the data in a timely manner. It is through the analysis of the data that the teams can be able to come up with useful insights. And this is what this third thematic area of analysis focuses on. So are the stock statuses routinely assessed? Is the country calculating and updating their forecast routinely? Are they using the updated data and the situational context to conduct scenario monitoring? And are they developing supply plans, which clearly indicate what needs to be ordered and by who and when? And then the other thematic area, the fourth one, focuses on supply planning meetings. So here we're looking again at, are they routinely scheduling these meetings? Are all the relevant stakeholders included in these meetings? And do they review the previous meetings, actions and recommendations that come out of these meetings, and do these meetings use evidence to inform the decisions that they arrive at? And then last, but what is most important, is the adjustments of the supply plans. So for this, we're interested in knowing if the recommendations for adjustments are communicated to all the relevant stakeholders, and if this is happening in a timely manner, and whether funding is available to be able to implement them. We can move to the next slide. And so once we completed developing and defining these characteristics of proactive supply planning, we used it to develop our current assessment tool. And here we can see an excerpt from one of the sections of that assessment tool. And in terms of process, the teams used the tools to assess their countries. And we did this during our vaccines collaborative supply planning team retreat that we had in April. So for some of the countries, we had the participation of their Ministry of Health officials at that retreat, and they appreciated the importance of such a structured tool to assess their countries and identify specific gaps that they have. And the results of the assessment, we use those results to map the countries into 3 phases. So essentially ad hoc supply planning, reactive supply planning, and proactive supply planning, with the last one being ideal, the proactive supply planning. And then we intend to use this tool to assess the countries over time, and also as a framework for thinking about how to support the countries to be able to evolve in different areas of supply planning. Next slide, please. Okay, so on this slide, we are digging into some of the results and from the assessment that we conducted in April. So on the left, we can see the overall performance for the different countries, with one of the 14 countries being at proactive supply planning. And then the bulk of the countries, that's 64%, they were at the reactive supply planning phase, and a handful of the countries at the ad hoc phase of supply planning maturity. And then the graph on the right just shows us some of the, it shows us the performance of one of the countries along the 5 thematic areas and how that compares to the average performance of all the other countries. So the dark blue bars are the country scores, and then the light blue bars that we have on the background, that gives the comparison, the average performance across the other all the 14 countries. So a country can be able to see how they compare on average with the rest of the countries. And then something that we are also working on, the dashboard, I mentioned that earlier. So this dashboard will provide the countries with an opportunity to drill down further into these results so that they can be able to identify the specific areas that they have low scores and they need to prioritize to address their gaps just to improve their supply planning maturity. Next slide. So in closing on this this maturity assessment framework, I would want to reiterate what I mentioned earlier. The reason for the assessment is just for the countries to be able to identify the strategies on what it is that they need to do differently, or which are the areas that countries need to put in place. What are some of the measures that these countries need to be able to put in place so that they can ensure that they are filling the gaps that they're identifying as they're assessing themselves. And here are just a few questions that they use to inform their action planning process. So how do we address some of the identified gaps for our country? What do we prioritize on? And how can we collaborate with the different stakeholders that we are working with, including partners and the non-state actors? And then at the coordination level, the different players and stakeholders can also utilize this information and the results of this assessment to basically identify some common patterns across countries and be able to strategize on how they want to structure their support to help countries address some of these challenges. And I'll now hand it back to Leila to take us through some of the decisions made by the supply chain actors.
Thanks, Janet. So as you can see, the process for how data is collected, different organizations meet, how often they meet, are they proactive, do they have the capacity and the ability to make decisions, is foundational to being able to have agile and responsive supply plans. But what is it that the team then actually has to do in terms of data analysis and decision making are the following. So being able to accurately from that information interpret what the current status is, being able to understand how many months of stock do we have right now, when is our product about to expire, and depending on the different forecasts that we have, how long will our stock last and when are the next orders coming in. So if there is a need to make a change can be made in advance instead of being reactive, right? Instead of being in an ad hoc position, not being able to be understanding what it is that's about to happen. So the choices and the decisions that have to be made are made with a delay. And so being able to make those supply decision means being able to let the COVAX demand planning or the bilateral donation country know whether or not you need that product and the quantity and the timeline that is being offered, and to be able to suggest an alternative to what it is based on the country's needs. Being able to avoid any risks of expirations. So trying to figure out if there is a large sum of Moderna that probably is about to expire in June, does that change what the country's policy is in terms of mixing and matching for second doses or booster doses and getting that product out in those settings or that campaigns so that it reduces the risk? Is that the decision that the country wants to make, or are they fine with the current activities and policies that they have in place to do that? But then the risk would be that you might be having some expired products, and that's if they know what the situation is, they can make more informed decisions about the risks they're making with the choices that are being made. Creating different scenarios would allow an understanding of looking at past trends when we talked about consumption per month, disaggregated consumption, understanding when that consumption, what was the status or the context for which that consumption took place historically. And if you're forecasting for something larger, what does that mean? So if you're doubling the efforts, are you doubling funds? If you're doubling or tripling efforts from the past campaign month, do you have enough resources and funding to be able to do that? And if you don't, then perhaps the forecast shouldn't be double or triple that if the funds aren't there to be able to cater for that level of effort. And so being a little bit more realistic about what the forecast can be based on what the historic information has shown you is the capacity for the system to perform. Looking at all across your suppliers, etc. And you see two viewpoints that are in the dashboard. So the first one to the left shows us the current stock status, and the gray is the inventory. The red bars represent upcoming expirations of products. The dotted red line represents the months of stock, and the black line at the very bottom represents the current consumption levels, which is further broken down in the next graph, which shows you consumption by product through time with the coverage percentage. And so being able to have these viewpoints hopefully allows for better decision making. If we go to the next slide, some of the benefits that we're starting to see from this kind of work is that, you know, being able to, again, identify the gaps in the data as we're working with countries. And I see a question also here that address this, that we know that the data is a foundational piece of supply planning activity, correct? And as we're working with the country teams and the partners to help them with this process, we are identifying what the data gaps are, and then trying to figure out amongst the partners and the donors and others in the government organization, what can we do to help with that process? And we've got a couple of, you know, the intent of this initiative isn't really to help strengthen HMIS or LMIS, but if there are small changes that we can make to making the daily call-in process perhaps more efficient. We have a colleague who's been helping several countries make that process a little bit more efficient, so it's not such a manual entry process, so that the central level users can perhaps have a dashboard where they can, you know, filter for the right data or do a pivot table for the right data. It doesn't require them to do manual calculations. Then that's some assistance that we're providing for the data to be better presented, and we can at least identify who we can go to help strengthen those, you know, various systems that are already in country. We're hoping, you know, obviously making this process that Janet spoke about and creating SOPs and making this kind of the meetings more routine helps with making this process more sustainable, and allowing for timely identification, which I spoke to earlier. And we think that by having increased quality supply plan outputs from the countries increases the procurement plans. We allow them to be more accurate. So instead of having to cancel an order, you never actually place an order. So the manufacturer, the supplier, doesn't have to scramble when they've got the shipment leaving the door to have to cancel that shipment, which then allows that supplier to make better decisions, which hopefully allows them to make better contracts with manufacturers and other suppliers, which in the long run hopefully makes everything cost a little bit less. When we have efficiency in these systems and we have better outputs, we have better forecasts throughout the whole supply chain, not just at the country level, but at the global level as well. And what we're also able to do by having this standardized process is be able to look at across the countries and see what are the patterns that we're seeing in preferences for vaccines? What are the patterns we're seeing in terms of consumption increases and decreases in time? Is there a demand increase or a decrease? Are there increases in months of stock, and what does that translate to in terms of what the needs will be from a global source? And what are some maybe perhaps triangulating wastage rates by vaccine or by multi-dose vial, and having more accurate information as to what actual wastage rates are, and then maybe pinpointing, is there a product or a packaging issue with the product that's creating a higher wastage rate? And we don't really know that until we have the data to be able to delve a little bit deeper into it and understand that information better. And with greater visibility, we'll have greater understanding of the situation. And with that, I think we've come to the end of our next steps. Thank you, Barbara. Next steps is to expand this process to routine immunization. We've developed guides to help the national logistics committees go through this process, kind of like an answers, question and answers to help them through the process of forecasting their scenarios. We are creating a draft report template for the logistics committee to send up to the folks within the ministry who are making some of those procurement decisions, so they have a better understanding of the stock status. We're going to work on some standard operating procedures for a committee. So translating some of those adaptive learning and that matrix on assessments into an SOP. And we think that all of this will eventually perhaps lead to an immunization van, much like we have for the global FP van, that will help global partners make better quality monitoring assistance to countries in identifying, prioritizing some of those challenges that they might see in more than one setting. And so now it's to the end where we, if you have any questions, if you are someone who is interested in seeing if this is something that's viable in your country, please let us know at vcspinfo@jsi.com. We'll receive your email. And we would love to see if we can work with you and your partners in country to set something up like this there. Thank you so much. Thanks, Barbara.
Thanks very much to Janet and Layla and for this presentation on the collaborative supply planning for vaccines, and very, very, very interesting. We have a few questions that have come in and that have been answered already, and that we'll share them with you, but there are a few that are unanswered. So I'm going to read them aloud and see if either Layla or Janet or I will be answering them. We know the first question from Cyril. Nice to have you with us, Cyril, today. We all know data is the foundation for supply planning activity. What is the data maturity level of these countries? Are there data structures set up in these countries? All these will impact the quality and reliability of data used for supply planning and other supply chain activities. So we're looking at the data maturity of these countries and the structures set up. And I think Layla has mentioned that they're not creating new information systems, but are drawing data from existing information systems and also from from shipment information and other information. Layla, do you have anything that you want to?
I was wondering if actually Janet wants to speak to this.
Okay.
Because we do have data as one of the pillars from in the assessment itself. Janet, do you want to address it, or I have it pulled up as well?
Yeah, so I can take that up. Yeah, so the different countries, yeah, like you rightfully said, they are at different levels. And remember, as we are working with them to strengthen their processes, these are some of the gaps that they are identifying at their own level and trying to find the best way to be able to address this. And so, well, we are not directly or in any way going to provide any support to the countries to strengthen their systems. They at their own level are trying to identify what is it that they can do to be able to close out on those gaps. Are there partners that they can work with at the country level or even at the global level to help them support and strengthen their systems? And one of the things that we've realized is that many of the countries initially started with other systems, but are slowly building up to channel their immunization, the COVID immunization data into the DHIS system that they currently are having at the country level. So we are seeing that traction or growth in terms of closing that gaps across the different countries. Thank you.
Thank you. Thanks, Janet.
And how we're measuring, how we're measuring some of those maturity for the data system is there a presence of a reliable system for disaggregated data? Do the users have access to that quality information? Is it accurate in terms of the actually representing what's in the system? And then are there reporting practices? So is data being shared in terms of reporting of data amongst the various different partners in the country?
Thank you. Great. The second question is not specific to this webinar, but is a general question for any immunization supply chain management. Apart from WHO Gavi effective vaccine management EVM SOP for immunization, do we have any other SOP for immunization supply chain as a reference tool for better logistics management? And we will in my follow-up email, I will be sure to add any resources that I know about that can help you in your work in developing the vaccine supply planning tool and so forth. Did you come across other
we've come
references?
across guides. So there's a WHO middle managers guide for supply chain management, and there is a guide for forecasting that I know is being revised currently by WHO. And if anybody else knows of any other SOPs or guides, please enter them into the chat for the question and answers.
Yeah, that would be great.
Yeah, we have seen country specific SOPs.
Right.
Yeah.
Right. Okay. And we'll try to share some of those out with you all in our follow-up email as well. I actually have a question to Layla and Janet, since we've answered the open questions, and I just want to say those questions that were answered in writing during the webinar, we'll share the question and answer with everybody as well. But in terms of country uptake, interest in your initiative, what has been the interest? What have been how do you think those countries are benefiting? What are some of the country experiences to date in doing collaborative supply planning?
Well, I think we have maybe at least 6 country representatives on the call that I noticed through the introductions and looking at the attendees. From what we hear from our perspective when we introduced this concept, 2 countries we just presented to the CHAI team in Lesotho last week, and the quote was, "This is the answer to our prayers." That's what we hear. I think it's I think by taking all the information, putting it in one place and making the dashboard something that's usable rather than something that just spits out the information that is, sometimes a lot of systems create tools that are not very usable. They're just sharing information without allowing the user to know how to use that information in which way. And what we've really tried hard to do, and even with today, is take the feedback from our country users and continue to make changes and continue to adapt the tool to meet their needs. It is not a static tool. It is a live tool that continuously has updates to meet their needs for what they need to do their work better. But if anyone who is on the call from those country program teams wants to add in their responses, that would be great. And I would say that when we started out, we had weekly calls with just the partners, so with the PATH or the CHAI or the VillageReach staff. But since then, we actually have their ministry counterpart now joining us on those calls. So we think that shows that they find it to be valuable. We have a number of ministry health colleagues, either who work in the cold room or who are, the director of their logistics working group or the deputy director of their immunization working group working in the EPI, who are part of our weekly conversations about, discussing challenges or discussing what the next steps are and what can we do to help improve their systems. So we think that they do find it valuable. It's for the most part, it's up to them, voluntary, to decide to join those calls. And so if they didn't find it valuable, they wouldn't be there. And I see that we have a comment from our Madagascar colleague, Stevens. The tool is useful and adopted by the ministry and country as a logistics tool for taking decisions. Thank you, Stevens, for your response.
Great, thank you. And I noticed that, so when Janet was speaking and that the maturity assessment tool and so forth, it monitors, and rightly so, monitors a lot of process and therefore sort of process indicators. And so are you planning to do any kinds of evaluation on output or impact indicators that may show that by doing this process and using this tool, you might be possibly seeing reduction in waste or improvement in stock availability? Or are you doing those are those part of the plan?
Janet, I'll let you answer that, but one thing I'll say ahead of Janet thinking about the answer to that is sometimes when you look for something, you find the problems first. So by creating greater visibility into the system, you might actually start to see the problems first, and then you start to see them being addressed. So it might be difficult to show improvement right
All
away.
right.
Yeah,
That's
but
fair
Janet,
enough.
go ahead.
Yes, so just like Leila said, and it's not static, yeah. So this time you identify certain problems, you address them, and there are also other challenges that these countries are experiencing from the, especially from the demand side of things, yeah. And they also need to readjust. So new problems keep coming up, and they keep addressing that and growing their maturity level. And even in terms of so some of the things that we already are seeing from the countries, the benefits that Lila was talking about, we are seeing decisions being made, yeah. So those are some of the things that we continue to monitor routinely as we engage with the countries, just to see how that is growing or is changing across the different countries.
Thank you. Thank you. Well, there are no other questions, so I think I'm going to just close up this webinar with a few parting comments. Thank you, Leila and Janet. This has been very delightful, and congratulations on this initiative. This is so looks like it's very exciting and will make a big difference, and I think it's well received. So thank you very much. So this is the end of the webinar. And today we looked at how data can be used to coordinate commodity supply planning to ensure continuous availability of vaccines and related supplies. And as I said, you'll be receiving a follow-up email with additional resources and the recording and the slides for this webinar and an evaluation form to help us improve future webinars in the series. We are now at the conclusion of our final webinar in the Improving Data Use in Immunization Supply Chain Management webinar series. I want to take this opportunity to thank Gavi, who provided the funding for the series, and we also want to thank all of our guests, including Leila and Janet, who have participated in the series over the last several months. Many thanks again to all of you joining us, including those who weren't with us today, but who have participated in previous webinars. So thank you for continuing your learning and your dedication to ensuring that immunization, vaccines, and supplies are available when your citizens and children need them. We wish you continued success, and also remind you to continue to participate in discussions on IPHL and the Boost Community of Practice site. They're both there for your as an ongoing resource and forum to raise and discuss issues related to vaccine and immunization supply chain management, and we hope you take advantage of those. So take care, and best wishes to you all. Many thanks for your dedication.